1. When designing a curriculum for dental anesthesia assistant trainees, which approach best ensures adult learners remain engaged? A. Delivering long lectures with minimal interaction. B. Encouraging self-directed problem-solving activities. C. Using standardized testing exclusively. D. Repeating material without context. 2. In adult learning, dental assistants preparing for anesthesia certification benefit most from A. Rote memorization of drug names. E. Case-based scenarios relevant to clinical practice. C. Avoidance of peer collaboration. D. Teacher-centered instruction. 3. When evaluating a trainee's ability to monitor patient vital signs during sedation, the most effective assessment method is A. Multiple choice written test. E. Oral questioning only. C. Direct observation in a simulated clinical environment. D. Reviewing textbook notes. 4. A dental anesthesia instructor notices a trainee is consistently quiet during group discussions. Which mentoring technique is most appropriate? A. Publicly calling on the trainee repeatedly. B. Ignoring the trainee's behavior. C. Creating a supportive one-on-one mentoring session. D. Reducing the trainee's participation grade. 5. Which principle of adult learning is most relevant when teaching assistants about anesthesia emergency protocols? A. Adults prefer theoretical models over practical application. B. Adults learn best when content directly relates to real-life responsibilities. C. Adults avoid collaborative problem solving. D. Adults require passive knowledge delivery. 6. A regulatory compliance requirement mandates accurate documentation of anesthesia logs. Which instructional strategy ensures trainees develop this competency? A. Memorization drills. B. Practice with authentic anesthesia charting templates. C. Group debates on documentation theory. D. Verbal recitation of compliance standards. 7. To evaluate whether assistants can recognize signs of hypoxia in patients, the best evaluation method is A. Multiple choice quiz on oxygen levels. B. Role-play simulation with pulse oximeter readings. C. Peer-to-peer discussion without demonstration. D. Instructor lecture recall. 8. When mentoring a new assistant struggling with pharmacology terminology, which strategy aligns with adult learning theory? A. Assigning a glossary for rote memorization. B. Using clinical case studies involving the drugs. C. Avoiding the subject until later modules. D. Delivering repetitive lectures. 9. A dental anesthesia assistant must demonstrate competency in managing recovery areas. Which evaluation approach best validates this skill? A. Written self-assessment form. B. Direct observation using a standardized skills checklist. C. Group discussion on theory. D. Memorized definitions of recovery stages. 10. Effective curriculum design for the dental anesthesia assistant exam should prioritize A. Knowledge isolated from clinical application. B. Integration of theory with supervised practice. C. Minimal opportunities for reflection. D. Instructor monologues. 11. In communication training, assistants must learn to explain sedation risks to patients. Which instructional method best supports this outcome? A. Memorizing regulatory terminology. B. Role-play exercises simulating patient conversations. C. Silent reading of informed consent documents. D. Peer grading of essays. 12. An instructor evaluating learning outcomes of a sedation monitoring unit should focus on A. Repetition of definitions. B. Performance-based assessments in clinical simulations. C. Asking yes-no questions during lectures. D. Grading based on attendance. 13. A mentoring program for anesthesia assistants should emphasize A. Autonomy, reflection, and guided practice. B. Passive note-taking. C. Memorization without context. D. Limited communication with mentors. 14. When a trainee fails to meet competency standards in patient monitoring, the most appropriate educator response is A. Allowing the trainee to continue without intervention. B. Providing targeted feedback and individualized remediation. C. Focusing only on group progress. D. Reprimanding the trainee in front of peers. 15. Regulatory compliance training for anesthesia assistants must prioritize A. Understanding and practicing adherence to OSHA and HIPAA standards. B. Reviewing outdated case reports. C. Avoiding discussions of patient privacy. D. Focusing exclusively on pharmacology. 16. Which adult learning principle should guide evaluation design for the national exam preparation? A. Relevance and applicability of assessment tasks to real practice. B. Reliance on abstract theories with no context. C. Testing exclusively through rote memorization. D. Avoiding formative feedback. 17. Communication skills for anesthesia assistants are best strengthened through A. Patient-centered role-play scenarios. B. Memorizing communication theories. C. Sole reliance on instructor lectures. D. Multiple-choice tests on terminology. 18. In curriculum development. Which strategy ensures alignment with adult learners' needs? A. Incorporating learners' prior experiences into instruction. B. Avoiding real-world examples. C. Limiting opportunities for peer collaboration. D. Prioritizing instructor convenience over learner engagement. 19. When evaluating anesthesia emergency drills, the instructor should prioritize A. Speed of memorization. B. Practical execution under simulated conditions. C. Written recall of guidelines only. D. Peer discussion without action. 20. Mentoring an assistant preparing for certification requires A. Setting realistic, measurable learning goals. B. Assuming the learner has no prior knowledge. C. Delivering information without interaction. Avoiding feedback to reduce pressure. 21. The most effective way to assess understanding of anesthesia pharmacology is A. Direct observation in a clinical role-play with medication preparation. E. Memorization of textbook chapters. C. Yes-no oral questions only. D. Student self-reflection journals exclusively. 22. Which regulatory element must be included in curriculum planning for anesthesia assistants? A. OSHA workplace safety standards. B. Fictionalized protocols. C. Instructor preferences only. D. Non-healthcare compliance examples. 23. In adult learning, the principle of self-directedness is best applied in anesthesia assistant training by allowing learners to research anesthesia complications independently, forcing all trainees into identical, rigid paths. C. Discouraging independent inquiry. D. Focusing only on lecture-based teaching. 24. Evaluation of assistants' competency in infection control during anesthesia procedures should involve A. Demonstration of proper aseptic technique in a lab. B. Written recall of infection control principles only. C. Reading OSHA standards aloud. D. Memorization without hands-on assessment. 25. Which communication strategy best supports informed consent discussions? A. Using plain language and active listening. B. Using only medical jargon. C. Reading the form aloud without interaction. D. Avoiding patient questions. 26. When teaching assistants how to interpret capnography readings, the most effective method is A. Simulation-based training with real-time feedback. B. Passive lecture on definitions. C. Reading textbook diagrams silently. D. Group debate on unrelated topics. 27. A curriculum aligned with the dental anesthesia assistant certification must include A. Evidence-based practices in anesthesia monitoring. E. Irrelevant general health theories. C. Personal opinions of instructors. D. Historical overviews only. 28. Mentoring techniques that foster confidence in new assistants include A. Positive reinforcement and constructive feedback. B. Withholding guidance to test resilience. C. Discouraging questions. D. Public criticism. 29. Which method best evaluates assistants' teamwork skills during anesthesia emergencies? A. Group simulation exercises with debriefing. B. Individual written tests only. C. Silent observation without feedback. D. Reading protocols aloud. 30. An adult learning-centered evaluation system for exam readiness should A. Incorporate continuous feedback and practical testing. B. Avoid real-world applications. C. Focus exclusively on memorization. D. Eliminate opportunities for self-assessment. 31. To maintain regulatory compliance in anesthesia training, instructors must A. Regularly update curriculum with current ADA and OSHA guidelines. B. Ignore recent regulation updates. C. Focus only on pharmacology without compliance. D. Use outdated safety protocols. 32. Communication training that prepares assistants for sedation procedures should focus on A. Empathy, clarity, and active engagement with patients. B. Memorization of terminology only. C. Avoidance of sensitive topics. D. Instructor-centered monologues. 33. Which adult learning strategy best supports retention of anesthesia emergency protocols? A. Active participation in high-fidelity simulations. B. Silent memorization of manuals. C. Listening to lectures repeatedly. D. Avoiding practice to reduce stress.